We are deeply disappointed by the decision of several countries to prohibit travel from a number of Southern African countries, including our own, following the identification of the Omicron variant. This is a clear and completely unjustified departure from the commitment that many of these countries made at the meeting of the G20 countries in Rome last month. When they were there, they pledged that to restart international travel, it should be done in a safe and orderly manner, consistent with the work of relevant international organizations such as the WHO, the International Civil Aviation Organization, and the International Maritime Organization, and the OECD. The G20 Rome Declaration noted the plight of the tourism sector in developing countries and made a commitment to support a rapid, resilient, inclusive and sustainable recovery of the tourism sector. Countries that have imposed travel restrictions on our country and some of our Southern African sister countries include the United Kingdom, the United States, the European Union members, Canada, Turkey, Sri Lanka, Oman, the United Arab Emirates, Australia, Japan, Thailand, the Seychelles, Brazil, and Guatemala, among others. Now, these restrictions are completely unjustified and unfairly discriminate against our country and our Southern African sister countries. The prohibition of travel is not informed by science, nor will it be effective in preventing the spread of this variant. The only thing the prohibition on travel will do is to further damage the economies of the affected countries and undermine their ability to respond to and also to recover from the pandemic. We call upon these countries that have imposed travel bans on our country and our other Southern African sister countries to immediately and urgently reverse their decisions and lift the bans they have imposed before any further damage is done on our economies and to the livelihoods of our people. We will continue to be guided by the World Health Organization on international travel, which advises against the closure of borders. Like most other countries, we already have the means to control the importation of variants to other countries. This includes the requirement that travelers produce a vaccination certificate and a negative PCR test taken within 72 hours of travel, and that masks are worn for the duration of travel.